I feel hopeless and tired all the time. I have lost interest in everything I used to enjoy. Reported by Miss Emily. Patient presented with a 2 month history of low mood, anhedonia, insomnia, and decreased energy. She reports difficulty concentrating at work, loss of appetite, and occasional basic thoughts of self harm. There was no psychotic feature, and she denied any substance use. Symptoms started after a recent breakup. First psychiatric history, one prior episode of depression at age 22 resolved with therapy. No suicide attempts or hospitalization. No substance abuse history. On mental status examination, patient appeared to be neatly dressed, poor eye contact, cooperative but slowed psychomotor activity, soft and slowed space, hopeless mood, affect constricted, thought process logical but slowed, thought content passive suicidal ideation, no plan or intent, cognition oriented to time, place, and person, insight and judgment fear. So this is the case of major depressive disorder, single episode moderate. As per DSM-5 criteria, symptoms must be present more than 2 weeks. Symptoms include decreased mood, anhedonia, insomnia, fatigue, poor concentration, passive suicidal ideation. What will be the management approach? It includes pharmacotherapy, psychotherapy, monitoring and safety, lifestyle and support. Pharmacotherapy start in sertraline 50 mg per day, titrate as needed. Monitor for side effects, GI upset, agitation, sexual dysfunction. Also, begin with weekly cognitive behavioral therapy, focus on cognitive restructuring and behavioral activation. Assess suicidal risks regularly, provide crisis hotline and emergency plan. Encourage regular exercise, healthy sleep and diet, psychoeducation about depression and treatment expectations. Involve family or trusted friend if patient consents. Good prognosis is usually good with treatment adherence. Risks of recurrence, maintenance therapy may be needed for 6 to 12 months post remission. Relapse prevention strategies, medication adherence, continuation of therapy, early identification of warning signs, regular follow up appointments.